Hi, it's Mary Braun Bates from the banks of Pawtuckaway. It's March 20th. And I'm going to talk a little bit more today specifically about asymptomatic people wearing masks in New Hampshire at this point. I'm on Pawtuckaway. This is my opinion, not the opinion of my employers. And this is not personal medical advice. If you want personal medical advice, please call your personal doctor. Isn't the lake beautiful right now? Look at, there's a little bit of mist, fog over the lake. It's just beautiful, and you can see the clouds reflected. It's so still. It's so beautiful. There you go. Now you can see it. So earlier today, I gave my analysis of whether or not asymptomatic people should be wearing masks at this point in time in New Hampshire, and came to the conclusion that probably we should, based on the idea that the supply chain of masks was robust. Well, I have since learned that the supply chain of masks is not robust, and that even facilities are having a hard time getting surgical masks, not the N95 mask that healthcare providers are supposed to be using, but the healthcare providers are supposed to be using when they are taking care of a patient who is COVID positive or suspected to be COVID positive in a situation where they are going to be generating a lot of respiratory droplets, such as intubation or sticking a probe into a stylet into their nose because they're swabbing them. So we're not talking about those kind of masks. The public should not have those kind of masks. If you have those kind of masks, please consider donating them to a local hospital or a local EMS, because we are asking our first responders to risk their lives taking care of COVID positive patients. And I think providing them with the best medical equipment we can, I think we owe them that if we can. So moving right along to the topic at hand of should asymptomatic people wear surgical masks in public. Earlier today, I said that I thought that at this point in New Hampshire that the risk of asymptomatic people transmitting COVID was high enough that yes, asymptomatic people should be wearing masks in public. And that analysis was highly dependent upon the supply chain being robust, which I have since learned the supply chain is not robust. In that case, the analysis changes significantly, and I'm thinking at this point that the mask you wear today is a mask you cannot wear for a day in the future, and we should be saving them for the future, unfortunately. It's horrible that, I'm advising what I think of as a slightly risky procedure today in order to save for the future, but that's what I'm doing. Hopefully the supply chain of masks will improve. The point of my earlier video was actually to talk about how I make medical decisions and how I evaluate information on the internet, and I kept it up and am adding this video to it because I think it really demonstrates how clearly how fluid this whole decision-making process is right now at this point in the COVID epidemic. And the lake is just so beautiful. I want you to be sure you get to see it. And the conditions of extreme uncertainty under which we are all trying to operate and make decisions. In medical decision-making at its best is, making the best decision in a setting of uncertainty with incomplete information. So, we're used to this, although what we got going on now is kind of extreme. But we don't get to make these choices. So there you go. I hope that as the sun starts to set today, that you had a beautiful day, despite the fact that there are many things about today that are not what we would choose. The sun's out, which always helps my mood a little bit, and it really is beautiful. All right, thank you for your attention. Thank you for your care. Thank you for your love. All right, stay safe out there.